go back.
So a huge thank you to Seema for her work and most importantly to the patients. Like those patients this morning, we already had a room full of patients sharing their ideas. The conversation about what quality is just beginning. We actually have video booths, 2 of them just outside, and we hope you'll take a few minutes today to go and add your video to the stories you hear today, regardless of what your role is in the healthcare system, regardless of your experiences, because again, this is just the first step in building up what we hope will be a real dialogue about what quality is and making sure that quality matters. As I mentioned, we combined this effort by bringing together a really thoughtful group of experts. And at the head of that was sort of the internationally known Dr. Adelstein Brown. We were lucky to find an international expert in our backyard of Toronto. And so, Steny? Oh, he likes the dramatic entrance from the back. We were going to have some music and some people cheering. And now, without further ado, the chair of our panel. Steny and I actually have had the privilege of working together, walk faster, man, for over about 5 years, actually many years. We were in the ministry together, and what many people don't know, partly due to the humbleness that is Steny Brown, is the initial act, ECFA, was largely under his pen and Susan Fitzpatrick, who's here today, tremendous leaders in the healthcare system, and the agency that is hosting today, Health Quality Ontario, again, under the leadership and the ideation of Steny and Susan. So 2 of the people who really helped make today, and Steny, so thank you so much for leading this part of the project.
Thank you. So it's a privilege for me to share the work of a committee that's worked for a really long time and has had wonderful, wonderful support at Health Quality Ontario, particularly from Michelle Rossi, as we've labored and struggled to get some clarity on things. What I do want to say, though, is it's very nice to present frameworks. It's nice to present lists of principles. I'm very proud of the work we've done, but the motivation, the why underlying it all is in the film that you've just seen and not on a piece of paper. That being said, maybe we could go to the first slide, please, or maybe I can do that. I can. So, I won't belabor a list of names here. Safe to say that all of the names that I'm going to scroll through very quickly, there's 1 or 2 little affiliations. They're all incredibly accomplished people who've done similar work here at a pan-Canadian level, and in some cases actually across the United States as well, showing that I do think we have something to show the world when it comes to quality. You can see more of the folks here from a variety of different sectors, a variety of different professions. And now let me go to the first bit. So why is a framework for quality important? So Danielle, as she starts to talk about quality, begins a conversation that's rich in data, begins a discussion of how we're doing. But we have a bad habit, just like with our many pilot projects, we have a bad habit of introducing different frameworks and really starting different conversations all the time. And this is a problem, because it's not a conversation then. If every time you move, again to use Danielle's phrase, from one body part to another or from one disease group to another, you start talking about quality in a different way, well, we can't actually talk about whether or not our system is performing. And perhaps more importantly, we can't get a perspective that's coherent and consistent on how an individual patient is doing. As it was said, again, many times, you're not treating just a body part, you're not just treating one disease, you're not just treating the list of complaints you can go through that day, you're treating a whole person. That person will move between places, that person will move between providers, and as they should. But you need a consistent way to look at it. The second reason why I think a framework is important, is it allows you to make comparisons and talk about how you're doing. And this is a very un-Canadian thing to do. We don't like to say when we're doing well. I always love watching the Olympics. A Canadian will win a gold medal, and they'll look kind of sheepish, and they'll look away from the camera, and they'll say, well, you know, someone else could have done it. And the American who won the silver will go, yeah, fantastic. But we do need that ability both to talk about when we're doing well and when we're doing poorly, and to have frank and direct discussions on that. And quite frankly, we need a framework that allows us to do that. And so the framework behind me is the framework that the committee has worked and felt is the best able to represent how we think about quality. But it's also the Institute of Medicine framework. It's also the framework that has been used for a long time by Cancer Care Ontario here. And now it becomes a consistent framework, comprehensive enough to catch all that's important to us in quality, but consistent enough for us to be able to draw a picture of quality across a patient trajectory, across a set of experiences that a patient may have, and to understand how we're doing well and how we're doing poorly, and to have that stimulus to do better when we're not, and hopefully that moment of pride to celebrate when we do. So why are principles important? Well, it kind of seems like a funny thing to say, right? Principles are always important. You should have principles. You should try to stick to them as well as you can. Principles are actually important for two reasons. First, they help make sure the how we pursue things is the right how. It's not just results at all costs. Our system is a reflection of our values. And so the principles that we choose are critical. They're also critical not only to how we make decisions, but to serve as a useful stimulus. I think many of us work very, very hard every day, and many of us, at the end of the day, hope that we've finally gotten enough done. But even that first principle, I think, is the corrective to that. We can't have a fixed mindset. We have to have a growth mindset. Part of the trust in our system is the trust that people will know what to do and they'll work for the patient. But there's also an aspirational trust in our system that we'll try to get better every day. And so even that very first principle is an example of that sort of stimulus, that it's a commitment to ongoing improvement. There's not a level that's good enough. There actually isn't an end to a quality journey. As you go through all these principles, the idea of achieving healthy populations reflects the fact, and thinking about Joshua's story about Richard, it's not just healthcare that fixes everything. There's a whole range of factors that contribute to health, and we have the opportunity to bring those together in the service of health and not just healthcare above all. Talk about a principle of accessibility for all. If Camille Orridge was here, she'd say it's the Excellent Care for All Act. And the emphasis is important because that's the promise in the system. Not just that it's a free system when you show up somewhere, but it's a system that will actually respond to you. And that requires a much more textured and nuanced and intimate relationship across all of our system. Partnering with patients, not serving patients, not working for patients, but partnering for patients. And the idea of balancing priorities. This is a new thing. Years ago, people used to do this gesture with their hands when they talk about quality or cost. You can have quality, or you can have cost. You can have efficiency, or you can have equity. But you can't have it all. And the logic and the wisdom has changed recently, and you see this reflected in things like AAA. It's not choose what you want to do. It's actually improve health, improve the experience, and improve the sustainability of the system. And again, going back to those pilot projects, when we do see folks focus on all three and balanced priorities, the system improves along all of those dimensions. And finally, this word that I think is an important word that we use far too rarely, this idea of wisely. So choosing wisely, it's using resources wisely. It's actually about stewarding resources, not to cut costs, but to increase value. And I will do this motion with my hands again. Quality is about reducing the inappropriate care. It's also about increasing the appropriate care, all in the service of a healthier population. Finally, what other elements of the framework do we need? Well, we probably need to accept that there is no single solution that's going to fix our health system. People like me love to talk about an idea that we think is great. Let's have an electronic medical record. That's going to fix everything. Let's change how we pay people within our health system. Let's regionalize. These are all important debates and ones where we need more evidence. But by themselves, they don't fix everything. People always talk about healthcare being the most complex thing that we can engage in. Well, it is. But that means that we're going to need to pursue solutions using many different avenues. And we won't say succeed with just one approach. And so it'll only happen when we, actually do a series of things, and you'll see them there below you and in the middle of the document that's on your seats as well. Let me talk a little bit more about a vision. And I think this is an important vision for our health system, and it's one where we struggled for a long time. It starts off with the idea that we actually can be world leading. We actually have been in the past. Years and years ago, and healthcare is an important part of this, if you were born in Canada, you'd live longer than anywhere else in the world. Years and years ago, there actually was perhaps a greater promise of certain things within our system, and we can be there again. And so it's a bold vision that says we can be world leading. Notice we couldn't kind of get to the un-Canadian thing of saying the best, we had to say world leading. But we can be world leading across all 6 dimensions based on the outcomes we deliver. But the second part is important as well. People always talk about politics in healthcare, and there are politics in healthcare. It is our largest public enterprise, and it's a reflection of who we are as a society. And so first and foremost, it should also be a just system. It should be one that engages patients and families and caregivers who come from many, many, many different areas. And perhaps most importantly, it's relentlessly committed to improvement. In 5 years, if there's someone up here on stage telling you that we're now world leading and we've achieved our vision, we've only achieved half of it. In 5 years, we should have achieved that vision, if possible. Maybe it'll be 10, maybe it'll be 15. But whenever we're world leading, we should also be making sure that we've set the next level of performance improvement that really keeps the inspirational side of today going strong. With that, I'll just say thanks for letting me share the work of the committee. Thank you to Joshua. Thank you to HQO. Thank you to Michelle Rossi for tolerating and guiding and supporting us throughout all of this. And good luck with the day. Thank you.